All right, hello, my name is Michaela Smith, and today I will be doing my presentation over pernicious anemia. So first off, we have a chief complaint, and the symptoms were taken from a peer-reviewed article. So this made-up story, I've come here to the clinic today for several reasons. Most days, I feel completely exhausted, both physically and mentally. My wife has noticed that I really haven't been acting like myself, and it is true that I snap sometimes when I shouldn't. I feel down in the dumps often too. I know I'm 65 years old, but I'm really concerned because on top of that, I feel like I have been having difficulty concentrating and remembering. I don't have much of an appetite, but I get even more dizzy if I don't eat. I just overall don't feel well with my stomach, and sometimes I get a headache. My main concern right now is the tingling I feel in both my lower legs, hands, and feet, almost like pins and needles. It's affecting my sleep and the walks I like to take with my dog. I feel abnormally weak. None of this is normal for me, and it started about a couple years ago and got worse. I'm not one to go to the doctor, but I know autoimmune diseases run in my family. I just am not sure what is going on and want to feel better. So we have this guy, and his main chief complaint is the numbness and tingling. All right, so disease process for pernicious anemia. So vitamin B12 deficiency has several causes, with pernicious anemia, PA, being the most common. Insidious by nature, PA presents itself as an autoimmune disorder with various symptoms that are seen in a variety of other disease processes, making it difficult to diagnose. Malabsorption of vitamin B12 in PA occurs due to a lack of intrinsic factor, which is a protein found in the stomach, or when the body produces antibodies against it. When this occurs, a reduction of red blood cells is seen, which in turn gives rise to many symptoms like fatigue, shortness of breath, dizziness, memory issues, and peripheral neuropathy. So a lot of these are coupled with the case study that I presented. So with this being said, we have a couple different differential diagnoses, especially with the peripheral neuropathy. And you'll see that a lot of these have the similar symptoms. So being able to identify which is really important. And that really comes with diagnostic studies, but we will discuss this later. So the first one is hypoparathyroidism. Symptoms include immense fatigue and depression, as well as numbness and tingling in the toes, lips, and fingertips. There can also be an autoimmunity aspect as well. Diagnosis is essential to avoid heart rhythm abnormalities and primarily test blood levels of calcium, magnesium, and phosphorus. So this would be a priority one. Diabetes mellitus, also known as DM. So diabetic nerve damage symptoms, especially pain and numbness in the legs, can be seen with DM as well as pernicious anemia. It is important to complete the necessary blood test to rule out or even couple DM with pernicious anemia, since it is possible for patients to have both. The third one is carpal tunnel syndrome. So numbness in the hands can be seen in PA and carpal tunnel syndrome. A physical examination can differentiate it from PA, however, it is something to be taken into consideration given its relation to the feeling of peripheral neuropathy and the possibility of it being coupled with PA. Vitamin B6 deficiency. One second. So multiple vitamin deficiencies really can cause symptoms that are very closely related to pernicious anemia because of the anemia that it causes. And symptoms include peripheral neuropathy, mental status changes, and glossitis. So extensive lab draws must be done so that we can figure out what's going on, or even couple both of the diagnoses together. Another last one to consider is alcohol use disorder. So this would be important, especially when taking a social history of the patient, because alcohol use disorder can cause symptoms that are very similar to PA, including neuropathy, fatigue, memory issues, and personality changes. Also, the consumption of alcohol may make symptoms worse if they do end up just having PA or both, because chronic alcoholism also can result in lower B12 levels. So it's something to keep in mind. So I split up pathophysiology into two parts. The first one is the understanding of the absorption of B12. So to the left, you can see a anatomy picture. So as I'm reading it, you can imagine the B12 being absorbed as it goes through the GI system. So intrinsic factor, as we know, is produced by the parietal cells of the stomach lining and binds B12 when consumed orally. The vitamin B12 intrinsic factor is also carried to the terminal ileum. This is where it will be absorbed once it binds to the receptors on the luminal membranes of the ileal cells. This is done specifically by receptor-mediated endocytosis. Once the B12 exits the basolateral membrane of enterocytes, it binds to transcobalamin, which is the blood carrier that delivers B12 to the cells. B12 is then used for erythropoiesis, which is the creation of red blood cells and nerve myelination. So understanding this, how it works, and what it does for the body will lead us into what happens with pernicious anemia. So part 2 with pernicious anemia, we'll go into that. The main cause of PA, also known as megaloblastic anemia, is due to decreased amounts of the absorption of B12 when there is an intrinsic factor deficiency. While lack of dietary intake of vitamin B12 is a cause of PA, autoimmune autonomic ganglionopathy, AAG, is also one. AAG damages the gastric parietal cells that secrete intrinsic factor and hydrochloric acid by the gastric proton pump. So this will severely inhibit what we talked about earlier with the absorption of B12. This is accomplished specifically by antiparietal cell antibodies that damage the gastric proton pump and cause gastric corpus, as well as the antibodies that go against intrinsic factor and lead to its deficiency. Since vitamin B12 is also needed for DNA synthesis, myelin formation, and red blood cell production, the lack of amounts of it in the body can cause abnormally large red blood cells to form, as well as sensory paresthesia and other various symptoms and clinical manifestations that I will further discuss. Okay, so clinical manifestations from the pathophysiology of pernicious anemia. So the majority of vitamin B12 is stored within the liver. So this is why symptoms may take up to 5 years to appear and worsen, like in our case study. Symptoms are also late to appear because of the body compensating and all the mechanisms that are present in the body to make sure that the oxygen delivery remains high. Eventually, clinical manifestations become observable with physical examination and include pallor, dry skin, jaundice, glossitis, palpitations, and tachycardia. The anemia aspect of PA also can cause a variety of symptoms, including memory loss and personality changes. The gastrointestinal aspect of PA, discussed earlier, can also cause diarrhea, dyspepsia, decreased appetite, and weight loss. Bilateral peripheral neuropathy, decreased sensation, and a positive Romberg test regarding balance can also be seen as neurological manifestations of PA. If not caught early enough, subacute combined degeneration of the spinal cord can occur, and this is unfortunately usually irreversible. 1 second. Okay. So, how do we diagnose? Through laboratory and diagnostic studies mentioned below. So first, what is usually done is a complete blood cell count. And this, of course, would be great with the differential diagnoses that I discussed earlier. It's significant for anemia, macrocytosis, and pancytopenia. However, a third of those with PA do not have macrocytosis, so additional tests are usually done. The next best thing, isolated serum testing. So checking the cobalamin level amount within the blood is usually completed with a diagnosis made when it is under 200. However, there is a low sensitivity and specificity linked to it. And then follow-up serology. So this includes checking for anti-intrinsic factor antibodies and antiparietal cell antibodies, which are found in 90% of PA patients. Luckily, when you combine both of these, there is a 73% sensitivity and 100% specificity. So when you're diagnosing, you should be able to get the diagnosis from this. However, pernicious anemia is very hard to diagnose, as I've been talking about. So sometimes bone marrow biopsy is needed. And you can see on the picture to the left, that's like the main number one thing that you can do. Because it'll show hypercellularity and abnormal maturation of myeloid and erythroid cells. And that's really what'll make sure that it's being diagnosed correctly. So once you diagnose, how do you treat it? So there are pharmacological and non-pharmacological treatment considerations. Vitamin B12 is found in a variety of foods, including meat, eggs, and dairy products. High-dose oral vitamin B12 of 1,000 to 2,000 micrograms can also be given to those who have difficulty incorporating vitamin B12-rich foods into their diet, like vegetarians and vegans. Sublingual and intranasal forms are also available. However, they are not as effective as the oral tablet form. And then lifetime treatment can also be completed through intramuscular injections of 1,000 micrograms of B12. When first diagnosed, injections are done daily, and then they start spreading that out in frequency to about every 2 to 3 months. And like I said, this is lifetime. Once you're diagnosed with PA, you're going to have to continue your treatment, even when symptoms improve, but that's something that you will talk about with teaching. In addition to vitamin B12 supplementation, folic acid and iron are also seen to help quickly improve PA and the symptoms seen in those that have it. So there are some cultural and sociocultural considerations. So PA is most commonly seen in North European citizens who also have a higher chance of acquiring autoimmune diseases than other populations, like our case study patient. It's also seen in both female and male populations, but mainly older than 60, also in our case study. There's also significance in mentioning that mothers who have PA and primarily breastfeed their children can cause their infants to acquire a B12 deficiency, which then can lead to neurodevelopmental delay and regression. So understanding that and being able to teach that, very important. Beliefs and values. So patients with various types may make treating PA more difficult. So examples are patients who are vegan, who believe against eating certain meats or dairy. There's different religions also that you can couple in with that'll make it difficult. And really, that's what you should be considering because we want to make sure to treat it so that the neurological damages do not become irreversible. So prognosis and expected health outcomes. So unless the subacute combined degeneration of the spinal cord has occurred, which is very rare, the prognosis of a patient diagnosed with PA is bright. Most of all the symptoms that come along with PA can be reversed or improved upon with pharmacological and non-pharmacological treatment options that were previously discussed. Typically within 6 weeks of adequate treatment, immense hematological improvement should be seen. The neurological aspect is much slower. However, catching PA early yields better expected health outcomes. So like I said, it's very important to start treating with B12, making sure supplementation is given so that we can ensure that we are not leading to irreversible damage. So, most importantly, the teaching and anticipatory guidance. So, teaching regarding treatment and the importance of vitamin B12 supplementation is vital to the health of the patient. The different routes, as well as the importance of the continuation of treatment for life, even when symptoms improve, is something that needs to be clarified for patients, especially if they have low health literacy. There's also an aspect of PA that is important to mention, which is the fact that those diagnosed with PA are at a higher risk for gastric cancer and other autoimmune disorders. So, endoscopy with topographical biopsies is recommended to ensure gastric neoplasia has not formed. So, that's something that you would bring up with your patients and make sure that they understand. Additionally, teaching pregnant and breastfeeding women, like I mentioned earlier, especially those who are vegan or vegetarian who have PA, um, to take vitamin B12 supplementation is vital to ensure the adequate formation of infants' brains and neurological development. And then here are my references. Thank you so much for listening and have a great day.